Thank you for inviting me, Francois. This afternoon, I will talk about real application of visual analytic applied to healthcare-associated infections. Today, I will talk about a case study on a healthcare problem, that how we have developed and applied a visual analytic process to a real-world application. So I will introduce you to the healthcare problems and the data set we have, and also illustrate the necessary first step to how to get to know your data, and also the use of visual analytic to discover information, and network analytic for analyzing infections, and then talk about the spatial temporal analytic applied for surveillance, and I'll give you a demonstration. So what is healthcare-associated infection? They are infections that patients get while they're getting treatment or surgery for medical condition in a hospital or nursing home. So I think a lot of you are familiar with Staphylococcus, MRSA, C. difficile. The problems we have here is that with HAI, patient will end up staying in the hospital for a longer period of time, as in some may cause prolonged illness, disability, or even death. So according to the World Health Organization, this will be a continual problem because we have very crowded hospitals, and we also have increasing number of people with compromised immune system, and new emergence of microorganisms and increased bacteria resistance. So how do we get it? You can see you can pretty much get it anywhere in your body. And how does it get transmitted? It's about the usual route through contact, airborne, waterborne, food, and blood exposures. So what can we do about it? What we can do is perhaps, for example, we can increase good hygiene practice, washing our hands, like you can see all the hand sanitizer everywhere in the hospitals and in a lot of public places, and also be more careful when we prescribe antibiotics, and improve our techniques and devices for treating patients. However, surveillance is the key factor in managing and reducing the infections. So the objectives of this case study is that we would work to monitor healthcare-associated infection to detect the outbreak by analyzing and understanding the infections, and visually analyzing which ward specialty, ward or hospital building have more infectious risk, and which one have very effective infection control strategy or record that we can learn from. And we also need to monitor the patient infectious status. For example, if the patient is recovering, just been infected, or has recovered, or never been infected. And also the movement and interactions of the patients, so that we can detect and identify any anomalies, cluster and patterns of infections, and the relationship between the patients and the hospitals or the treatment, and also detect any trends. So that in this way, we can detect and identify potential outbreak early. So the data set we have is real data set, have a 4-year period with over 400 patients, more than 8,000 admissions across 10 hospital buildings, 127 wards, and 14 medical specialty. Now this is real data, so real data is never perfect, but I think it's very useful to have real data. So what does the data have? It's an Excel spreadsheet. We have the patient identification. We know when the patient was admitted to the hospital, when the patient was discharged, and we also know which hospital building, which ward, and which specialty. But we also know that when the patient was first tested positive, and the last time the patient was tested positive. So now I'm going to show you how we can analyze and explore data using visual analytic. Why are we using a visual analytic? Because the spreadsheet contains about 8,000 records with 8 fields. Unless we can analyze it visually, it's impossible to understand and simulate what's going on in this raw data. I mean, everyone knows looking at the spreadsheet is not the most exciting thing to do. So without interactive visualization, it would be impossible. So now I'll show you how we have done it. So what is visual analytic? Visual analytic is a science of analytical reasoning supported by interactive visual interfaces. So I'm not going to alter that, but to show you that visual analytic is about data sciences, analysis, visualization, and representation, interact dynamic, so that we can make sense of the data, assembly evidence to support us. I will give you a range of visuality and visualization to getting the feel of the data. I will use very simple visualization techniques first. It's important for us to use these important for us to use simple techniques for us to get to know the data, understand the data before we dive into something really complex and sophisticated. So here we just show you the admissions of the patient over the 4-year period. And you can see that the record for some of the hospital buildings cover the whole 4-year period. And you can see some of them cover the beginning, some of them cover the end, and also there are variations in the number of admission. You can see the marked variation in the case of CH and JR. Others are very flat. So this will give you a first, might contradict what you might have thought, that they would be pretty similar across them, but now you can see they're quite different. Next, we look at the total number of admissions in each of the 10 hospital buildings. You can see that CH has more than half of the admissions because the total admission is 8,479, and JR follow, and then XG, the others have very small numbers of admissions in this data set. And we also look at monthly pattern of admissions across the years and also average of the month. You can see that there's not really a lot of thing we can draw on having the patterns here, temporal pattern. So what about the patients? We can see each line represents a patient. The length of the line is about the number of admission. So you can see that some patients come to the hospital quite frequently. Some of them only coming once. And I also color-coded it by the different hospitals. So you can see which hospital the patient was admitted to and how many times. So this is a dashboard, dashboard is a display that you have multiple displays all put in the same display, but they are all interlinked. So if you click on any of the features in any one of the display, all the corresponding features in other display will light up, will show you. So that's a very good way of looking at large dimensional data. So here's an example. I click on this patient. You can see immediately this patient has about lots of admission and 755 in fact, and you can see which hospitals that the building that this patient been in, and also when the patient was admitted. So you can see that it started off with mainly in CH, and then towards the latter half of the recording period, it moved to SM. So that now gives you a lot more information about the patients and when they were admitted and where they were admitted. So it's temporal and spatial. So from analyzing the data among these patients, we find that broadly there are 3 categories of patients in this data set. We have the dialysis patient, we have the medical assessment unit patient, that patient come for emergency from the A&E or from the GP, and we have other patients that are non-dialysis, non-MAU. So this is showing you that patient tested positive while in hospital, which is what we call the in-ward infection. Of all the 8,000 odd admission, 450 of them result in in-ward infection. That was, they were infected while they were in the hospital. And we also want to look at the number of infections in each hospital building. We know there are a lot of admission, but the number of infections is actually far more in JL than anywhere else. In fact, in 1998, it peaked right at the top. However, if you look at it, gradually within 2 years, it dropped significantly. In fact, over the years, the number of infections has reduced. And you might have noticed that out of the 10 buildings, 3 of them didn't have any in-ward infection. SMCC and WG, they didn't have any infection. So that's why you only see 7 here. So that's something that you discover. And we also look at seasonal variation across all the buildings. You can see that July, August, and September had the lowest incidence. November had a higher incidence, more than twice of August, but you don't really see a very obvious seasonal pattern here. Here is the infection frequency plot, which we're looking at how often infection occur at any particular interval of days for each hospital building. So I just pick an example here. You can see CH and HG had a wide range of days between infection. JRs tend to be cluttering over the 3 period. You can see that the reoccurrence is around the 30 days period in JR. So you now can see some characteristics of the infection in different buildings. Here we're looking at the patient hospital stay. We look at how long each patient stay for each of their admission. You find that the bottom is the patient identification. The y-axis is the length of the stay. You can see again it varies a lot from 0 days, sort of just in and out day visit, to about 147 days. So there is a wide variation, and the color also coded with a different hospital building that will also show you more information about the length of the stay of the patient. So now I've shown you some basic ideas and how we have explored the characteristic of the data. We now look at using visualization, Analytic to discover information. So here is the infection transmission. So what we're looking here is a new positive test after a known positive patient moved to a ward. So on the y-axis is the number of days since the patient was tested positive before being admitted to the ward. So right at the top at the corner is on the day that he was tested positive, he was admitted to the ward. As we go further down is that the number of days after he was admitted to he was tested positive before he was admitted to the hospital, and right across is the number of days that he has stayed in the hospital. And the number inside each cell show you the number of new positive tests for that after he moved into the ward. And you can see that as the number of days after he'd been diagnosed, before he moved into the hospital, admitted to the hospital, then less and less infections. Okay. And you can see the striation here. This is associated with the dialysis and renal patient because they presumably coming into the hospital on repeating cycle, and this diagonal is a number of multiple of the number of day cycle. So now I filter it, and so I remove all the patients with more than 10 admissions, and also from the MAU, and also I'm restricting the period of infectious period for 8 weeks and incubation periods for 12 weeks. So you can now see much clearer, and so you can see now that more days after the patient was tested positive before he moved into a ward, the less new cases that will happen here. So now we're looking at incubation and infectiousness period. So the top part is the incubation period, and you can see that there are far more new cases during the incubation period than during the infection period when the patient was diagnosed. So from this one, you can see that if the patient is far more infectious during incubation, but much less after diagnosis. Maybe it's being managed better with more management, and also maybe he is not as infectious. So here is a frequency plot. Is the summary of what for the plot I showed you. So you can see clearly that the infectiousness during the incubation time period and the infectiousness after being diagnosed, and also the infectiousness around the diagnosis. So we can see that for the case when a patient tests positive before being admitted to a ward, the number of new positive tests is dramatically reduced compared with patients that test positive after moving into the ward, that is the incubation time. This could be that once they tested positive, the patient get proper treatment and management, possibly reducing the infection spread to other patients. And it can be observed that the total positive test number reduced after approximately 20 to 35 days. So this is a parallel coordinate plot, one of my favorite. So far I have seen you analyzing data 2 parameter, 3 parameter. Parallel coordinate plot allow you to do multivariate analysis, and a very powerful technique. So And the first one is the patient ID. So along the axis is the patient, individual patient, and then the hospital building, the ward grouping, and the number of the days that the patient stay in the hospital, and also the number of days that the patient was diagnosed before the patient was diagnosed. So how long during the patient stay before when he became infected. So I highlighted here, I just looked at CH. So you can see all the patients that are associated with CH, and then you can see the ward that these patients were admitted to and the ward grouping, and you can see that they're quite variable length of stay they stay, and also the number of days they stay in the ward before they became infected is all variable. And so you can pick on any of these, and we will highlight all the related information for you. And we also use sidebar, so you can have a range of the information. So, for example, I'm only interested in people who stay for within 7 days. I want to know what happened to them. So you can look at that. Who are the patient? Where they were? What was speciality? And other characteristic of the patient. You can also look at the length of stay. How long what is the length of stay? If they stay a long time, do they get more prone to infection or less? So this gives you a very powerful and very useful way of analyzing multivariate data. So this is another example of dashboard. So as I said just now, I highlighted the per coordinate. In the dashboard, I can have other display as well. So here I have the patient ID, and you know how many times the patient was in the hospital and when it was positive, and also the middle one is just the CH, and you can look at the length of the time that they stay in the hospital, and also when they get infected, and also different ward grouping. So this gives you a very useful way of looking at data, and so clicking on any of these display will result in highlighting the rest of it. So give you a very useful way of maybe you're interested in particular ward, or you want to look at the association with other information. So now let's just look at the infection network. How do they get transmitted between patients? So let's just look at this particular patient, 5543134. And you find that between April and September, the majority of the infection happened at JR ward grouping 2 within the social group of this particular patient. And so these are all the patients that have come into contact with this particular patient. So we now want to look at, can we track the infection? How does it happen? The sequence of it. Who is infecting who? So this is a sequence graph. So in this social group, the circular group, you see the first patient in this outbreak is P1389654. That's the first one. And then the second one. And then up there. So you can see that, also interestingly, there are 2 patients that were never infected. And there are other patients that were infected, but we don't know where the infection comes from, because by calculating the infectious period and also the infection time, it doesn't, the length of the period is too big. So we need to investigate them individually. So ideally to analyze the whole patient population for all the infection. So what we've done here is that you can see that the patient was infected twice. And the first time, the patient could have been infected by these four patients that he came into contact with. And then he could have infected these other patients. And then he was infected second time by a different patient. So you now see a sequence of infection, how it happened. Now, at this point, we assume they have the same infection typing, but they could be different typing. So that will make it very interesting to look at, are they the same typing? Knowing that they come from different hospital buildings, and could be something that ought to be investigated. So we have looked at patient-to-patient relationship. What about the network, the relationship between hospitals? So this is a connection between different hospital buildings of a network. The darker the colored green is the stronger the link between the hospital. The lighter brown means less connections, and the size of the symbol is also reflect to the number of connection. So what it shows here is that the patient who admitted to one hospital also admitted to another hospital, and that creates a relationship between the two hospitals. So this is the inferred relationship between hospitals. So we try to WG have very strong link with CH, but not a lot of link between JR. JR have strong relationship with everybody else. This is another is a different data set, but I'd like to show you about the two-mode network, which is the patient and the hospital buildings. What is interesting here that you can see that the CC is isolated, has no connection with other hospital buildings. But what is very interesting is that up there, here, this patient is what we call the between centrality. This is the one bridging the relation, bridging the connection. So if you take out this patient, that means there will be no connection. But looking at the relationship of this patient and the status of patient will give you a lot of insight into what's happening as well, because this is the one connection that put them together. And this one, similarly with this patient, also is the have very strong go-between relationship between these buildings. So far we have looked at the spatial and also the temporal. Now I will show you the spatial temporal visual analytic that we have developed for in-ward infections. So what we're trying to do here is visualizing the patients and their contact moving in and out of the hospital and around within hospital, so that the infection control personnel can visually analyze the patient movement, their status, and their interaction, as well as allow you to filter the data, look at specific characteristics that you're interested in, and also querying particular individual patients. So this is the front end. At the top, the gray bar is outside the hospital building is the community, and you can see that each of them, JR, CH, now is the first time you can see why JR is actually has more infection than others. It actually is a very complex structure. Until we look at this, you're thinking why CH has more admissions but less infection. That might be some area that one should look into, and each each ward is also color-coded by the specialty. So as a glance, you can see which building have the same specialty, which is unique, and you can see that SM and IC, they're very small with just one specialty. So each patient, we have about 400 odd patients. You need to represent them uniquely. So we have an icon with a letter and a background color. The letter is white is when the patient is not infected. The letter is red when the patient is infected, and pink when the patient is recovering, and gray is when the patient has recovered, because we want to differentiate those patients have never been infected from those patients that have been infected but they have recovered. And the letter will flash red when the patient is tested positive, so we can draw attention to his new status. So here we're looking at the movement of the patient from dark to light. So you can see I just been admitted from the community into the JR ward grouping 2, and you can see that patient M and W are infected, and then you can see that Z is recovering because it's in pink. So at a glance, you can see how many patients in each ward and what are their status and where have they come from. The reason I said where they come from, you can see that they're not necessarily coming from the outside. Over there, you can see patients being transferred to a different ward within the hospital. So we can look at patient detail. You click on it and we'll bring up the patient details. So that's interesting, wonder what's happening to the patient. You can look at the surveillance, for example, 5 infected patients, 2 recovering, and 1 recovered patient out of 19 patients in the JR building. This could be an alert of a potential outbreak because of the proportion. So you can set up some threshold to look at the number of infections you're expecting, but the number that can be out of the norm. Of course, you'll be delighted if you have less. So we can also filter the data, the patient. We can look at patients who were in the hospital 30 days before and after they were tested positive. So here are the patients that fit in that characteristic. We can do contact tracing, which I just showed you about looking at this patient who the patient was in contact with. So that's very useful to look at the interaction and where they were during the interaction. So finally is the surveillance system. What we can do is to have that and integrate with in the dashboard. I love dashboard. And you can look at the emissions and the predictions. The dotted line is the prediction. So that gives you a kind of threshold and warning. And then you can look at the emission of patient, the status, and other information that you are interested in. So I now just demonstrate to you. So I just play the, so you can see the patient coming in and out, did it very fast. So you can see patient tested positive, is starting flashing to you and then gradually turn into pain as they were recovering. So in conclusion, I hope you can see that Visuanalytic provide the only practical means of exploring, analyzing, and understanding large and complex raw data set of patient information. The spatial temporal visualization tool can be used with minimal training because it's very intuitive, doesn't need a lot of explaining. And also you can see that it is impossible to understand and analyze the data in its raw spreadsheet form. Visualization is essential for analyzing these inherently non-visual spreadsheet data. But beyond graph, more sophisticated techniques such as the spatial temporal visualization are essential, but they do become more specialized and more difficult to implement. Visuanalytic provides a very intuitive and effective way of exploring data to detect anomaly, trends, pattern, cluster, recurring event. What is really good is to detect the expected, but more importantly, it can help you discover the unexpected. Thank you.